There is excitement until the day of delivery comes. The birth of a child is indeed a blessing. There is joy after the pain. During labor, a pregnant woman who is about to give birth needs support and reassurance. A nurse who is much knowledgeable about the elements and the mechanism involved during labor and childbirth would be a great help in the whole labor and birthing process. An experience of the patient by closely monitoring the mother and demonstrate appropriate assessment and give teachings such as stages of labor. The nurse can help control their pain better through breathing techniques and reassurance of presence and care being provided to the patient. Nurses are also expected to display a thorough and gentle approach during assessment and doing procedures, as this is a time that a woman would most likely be sensitive and anxious. So, what is labor? Labor, or parturition, is a series of events by which the uterine contractions and abdominal pressure expel a fetus and placenta from the uterus. Regular contractions cause progressive dilatation of the cervix and create sufficient muscular uterine force to allow a baby to be pushed out in the extra uterine world. Labor represents a time of change, as it is both an ending and a beginning for the woman, her fetus, and her family. The first stage of labor and birth occurs when you begin to feel regular contractions, which cause the cervix to open or dilate and soften, shorten, and thin or effacement. This allows the baby to move into the birth canal. The first stage is the longest of the three stages. It's actually divided into two phases of its own: early labor or latent phase and active labor. Early labor. During early labor, your cervix dilates and effaces. You'll feel mild, irregular contractions. As your cervix begins to open, you might notice a clear pink or slightly bloody discharge from your vagina. This is likely the mucus plug that blocks the cervical opening during pregnancy. So, how long does it last? Early labor is unpredictable. For first time moms, the average length varies from hours to days. It's often shorter for subsequent deliveries. So, what can you do? Until your contractions increase in frequency and intensity, it's up to you. For many women, early labor isn't particularly uncomfortable. Try to stay relaxed. To promote comfort during early labor, it is best to go for a walk, take a shower or bath, listen to relaxing music, try breathing or relaxation techniques taught in childbirth class, or change positions. Your healthcare provider will instruct you on when to leave for the hospital or birthing center. If your water breaks or you experience significant vaginal bleeding, call your healthcare provider right away. Active labor. Now it's time for the real work to begin. During active labor, your cervix will dilate from 6 centimeters to 10 centimeters. Your contractions will become stronger, closer together, and regular. Your legs might cramp and you might feel nauseated. You might feel your water break if it hasn't already and experience increasing pressure in your back. If you haven't headed to your labor and delivery facility yet, now's the time. Don't be surprised if your initial excitement wanes as labor progresses and the pain intensifies. Ask for pain medication or anesthesia if you want it. Your healthcare team will partner with you to make the best choice for you and your baby. Remember, you're the only one who can judge your need for pain relief. So, how long does it last? Active labor often lasts 4 to 8 hours or more. On average, your cervix will dilate at approximately 1 centimeter per hour. So, what can you do? Look to your labor coach and healthcare team for encouragement and support. Try breathing and relaxation techniques to combat your growing discomfort. Use what you learned in childbirth class or ask your healthcare team for suggestions. Unless you need to be in a specific position to allow for close monitoring of you and your baby, consider these ways to promote comfort during active labor. Change positions. Roll on a large rubber ball or birthing ball. Take a warm shower or bath. Take a walk, stopping to breathe through contractions. Have a gentle massage between contractions. The last part of active labor, often referred to as a transition, can be particularly intense and painful. Contractions will come close together and can last 60 to 90 seconds. You'll experience pressure in your lower back and rectum. Tell your healthcare provider if you feel the urge to push. Stage 2, the birth of your baby. It's time! You'll deliver your baby during the second stage of labor. So how long does it last? It can take from a few minutes up to a few hours or more to push your baby into the world. It might take longer for first-time moms and women who've had an epidural. So what can you do? Push! Your healthcare provider will ask you to bear down during each contraction or tell you when to push, or you might be asked to push when you feel the need. When you push, don't hold tension in your face. Bear down and concentrate on pushing where it counts. If possible, experiment with different positions until you find one that feels best. You can push while squatting, sitting, kneeling, even on your hands and knees. At some point, you might be asked to push more gently, or not at all. Slowing down gives your vaginal tissues time to stretch rather than tear. To stay motivated, you might ask to feel the baby's head between your legs or see it in a mirror. After your baby's head is delivered, the rest of the baby's body will follow shortly. His or her airway will be cleared if necessary. Your healthcare provider or labor coach will then cut the umbilical cord. Stage 3, the delivery of the placenta. After your baby is born, you'll likely feel a great sense of relief. You might hold the baby in your arms or on your abdomen. Cherish the moment, but a lot is still happening. During the third stage of labor, you will deliver the placenta. How long does it last? The placenta is typically delivered in 5 to 30 minutes, but the process can last as long as an hour. What can you do? Relax. By now, your focus has likely shifted to your baby. You might be oblivious to what's going on around you. If you'd like, try breastfeeding your baby. You'll continue to have mild contractions. They'll be close together and less painful. You'll be asked to push one more time to deliver the placenta. You might be given medication before or after the placenta is delivered to encourage uterine contractions and minimize bleeding. Your healthcare provider will examine the placenta to make sure it's intact. Any remaining fragments must be removed from the uterus to prevent bleeding and infection. If you're interested, ask to see the placenta. After you deliver the placenta, your uterus will continue to contract to help it return to its normal size. A member of your healthcare team will massage your abdomen to make sure the uterus feels firm. Your healthcare provider will also determine whether you need stitches or repair of any tears of your vaginal region. If you don't have anesthesia, you'll receive an injection of local anesthetic in the area to be stitched. Now, what to do? Savor this special time with your baby. Your preparation, pain, and effort have paid off. Revel in the miracle of birth.